Hello viewers, you're welcome to Enlightenment program that seeks to enlighten you on issues that relate to your brain and spine health. My name is Dr. Bongekbene, consultant, neurosurgeon with the University of Uyo Teaching Hospital in Uyo and a lecturer with the University of Uyo. In our last video, I had told us about some of the causes of low back pain, and we emphasized degenerative disc disease as a cause of low back pain. Today we are going to look at a very relatively common condition called a slipped disc. Slipped disc is also called disc herniation or disc prolapse. It occurs when the soft component of the spinal disc, which is in our backbones, pushes through either a weakness or a tear on the outer ring of the disc, compressing the surrounding nerves or spinal cord, causing pain, numbness, tingling sensation, or weakness of the muscles supplied by those nerves. This is a model of the spine, and this part is the lower spine. This is the lumbar vertebrae. This is the sacrum, and this is the coccyx. So this is where the buttocks is. This is your lower back. These are the bones, this white part that looks like boxes. These are the bones that form the backbone. In between the bones, you'll see this. These are the discs that cushions the bones, adjacent bones. It prevents the bone from resting on themselves and causing pain. So they are served as shock absorbers. So if you jump up, the bones don't hit the adjacent bone because of the disc. So the disc has an inner soft component and an outer tough ring that serves to prevent or confine the soft part and prevent it from coming out. When there is a tear or weakness of this outer rim, then that soft jelly-like part can push through that weakness and compress the nerves. What I'm touching right now are the nerves, and they lie just behind this disc. If the disc protrudes backward, it will compress this nerve. And this nerve, whatever part of the body it supplies, suffers. It will cause pain, it will cause tingling, it will cause weakness of the muscles involved. If it is the nerves that go down the leg, it can cause shooting pain that goes down the legs, called sciatica. So what are the causes of this slip disc? It can be related to aging. As one ages, the part of the disc, the outer rim, is not as tough and resilient as it used to be. As a result, the soft component can push through that weakness and compress the nerve. It could also be caused by lifting of a heavy objects, like those who are sportsmen who carry heavy weights, or those who are manual laborers who carry heavy weights. Especially if the lifting technique is defective, is poor, then that can give rise to pain, can give rise to this slip disc. Also, it can result from poor posturing, prolonged sitting, obesity, which puts so much strain on the spine from the excessive weight. Could also occur from repetitive movement of the spine, bending and standing up, especially in activities like manual farm work or other manual forms of labor. All of these, especially if done without taking consideration of the lifting and the posturing technique, can give rise to this condition called slipped disc. Pregnancy also, which can cause heavy weight on the spine following the protruding stomach, abdomen, as well as the fact that there is laxity in the ligaments, tendons, and muscles surrounding the spine following the hormonal activities in the body at that time, can all give rise to a disc prolapse. So, how can this condition be treated? If you notice or know somebody who has this kind of problem, then you need to see a doctor immediately. Treatment most times is conservative. Within 4 to 6 weeks of onset of this problem, pain usually gets better. Patients may experience symptoms of pain, numbness, tingling sensation, which would last 4 to 6 weeks and usually managed by short period of bed rest, usually not more than 3 days, and mild to moderate exercise as much as pain can permit, and analgesics. All of these activities can help reduce the severity of the pain. And in most instances, pain usually resolves within a period of 4 to 6 weeks. If the pain persists for a longer period of time, or you notice that you are beginning to lose sensation in the lower extremities, or you're beginning to have problem controlling urine or stool or erectile dysfunction, all these are telltale signs that something more serious is happening. You need to see a doctor immediately. And the doctor, who is a spine specialist, can advise. And if surgery is required, that can be done in a timely fashion, and that can be life-saving and also save your limb. So, how do you prevent this condition? Avoid lifting of heavy objects as much as possible. And if you must lift heavy objects, then the right lifting technique must be applied. Avoid prolonged sitting. And if you must sit for long, then you can break it into intervals of 30 minutes interspaced by 5 minutes of walking around, just to delay or prevent that continuous sitting. Exercising strengthens your muscles and also helps you maintain a healthy weight that will prevent so much stress on your spine. Also, if you must be involved in farming work, then be sure that you apply the proper technique of bending and raising your body up so that you prevent or reduce the stress that your spine is subjected to. And if you happen to have symptoms that I've mentioned earlier, then it's important that you present early to the hospital. If you like the video, you can forward it to others who can benefit. And you can also share the videos and watch out for the next video. Thank you.